So let's get really specific where you are now, because now we've caught up to present, we've done past, present, and now let's do future. Yep. How is ATI specifically doing some of those things? Because similar to a role like a CVS, where you had physical space where it needed to be, right, in people's communities, ATI 900 plus locations. How is ATI going to tackle some of the things, some of the issues we just talked about? What are the things we look forward to in the future?
So I mentioned one of them that I'm excited that we've been working on for a little bit, which is the hybrid model.
Yeah.
And I think that is, we have it in different parts of the country. We have a national practice. We can provide virtual care and the bricks and mortar care. And so I think, again, I'm a big proponent of that. I think it helps with not only access, it also helps with adherence. And it also helps empower patients, right?
Sure.
To take this on their own and do their exercises and all that kind of stuff. So I think that's a big one. I would say, another is we're going to continue. We always look at the patient journey and what are the obstacles getting in the way for patients to access the care. And so we are constantly challenging ourselves and looking at how we, our hours of operation, how we show up for our patients. We have a team-based care model. And so we also think about that as having multiple providers, if you will, that they interact with and they can learn differently from. I would say we're very committed to making sure that care is affordable. And so, again, working with multiple commercial and government payers and looking at how to make sure that patients understand what their responsibility is and being really transparent around that. I think that's super important for patients so that they know what they're walking into, especially with multiple visits and an ongoing relationship.
Well, it sounds like you're paying attention to the people you're trying to serve, paying attention to what reasons or what obstacles are in their way and attempting to remove those. Again, that's access.
Yeah. I'd say, another thing that we had at MinuteClinic and we have here, we're a national practice and we have standard clinical guidelines. And of course, there's always decision-making and autonomy by a provider to provide the best care based on what the patient's needs are. But I think knowing anytime you go into an ATI, it's the same clinical standards, it's the same guidelines, and even just the same registration process. Right. So we have one way of doing things across all of our 900 plus clinics. And so again, that was a page I took out of the MinuteClinic book, but to consumers, to patients, like knowing that consistency is there, I think is really, it just, again, removes one more hurdle for a patient. And then that the clinical guidelines and the rigor behind the clinical, the way we provide care, all outcomes based, et cetera, based on, good best practices and research is applied across all of the ATIs.
That's what you want to bake in the cake. That's what you want to make sure is included in the ingredients, right?
Yeah.
Yeah.
And I think that is a differentiator for us. And I learned it at MinuteClinic, like I said, whether it be patients traveling, around to different places, or just like that brand and understanding what that brand stands for is, believe it or not, and it makes access easier.
Well, that's what a brand is. I mean, that's where we come back to my communications background. People think it's a logo or colors. And I said, that's a really visible part of a brand. A brand's a feeling. What do I get when I walk in or when I think of you, or, what experience is it? Is it annoying to book a time? That's a negative brand experience. Is the place, hard to get to? Negative brand experience. So it's a lot more than the logo and the colors.
Yeah. I'd say the other thing that I'm really pleased with at ATI is, I'm under the mantra of happy providers, happy patients. And so how do we support our teams and create the culture that makes people, feel good about what they're doing every day? It makes them feel like I felt when I was a candy striper, just like I liked being there. This was my place. And so we work hard on that. It's not static, and it's not perfect. But the providers they're who we are, right? They're in a care delivery organization. And so making sure the providers have the tools they need, the support they need, and feel good about coming to the clinic every day, or coming to the work site wherever they are, I think is really important. And again, our patients feel that. Our patients feel cared for when they go into the clinic, and it's how they're greeted. It's what their treatment plan is, and then it's how the provider and the team there bends over backwards to help them when they had to bring in their granddaughter because, she didn't have a babysitter and they didn't want to miss their session. So
Right.
I'd say that. So creating a welcoming environment, creating a spirit and an energy in our clinics. It again, when you talk about access, it's inviting and it makes people want to be there, our patients, even though they don't want to be there.
But that's part of brand, right? I mean, there was a pretty controversial book that came out. I think it was like Patients Come Second. And everybody was like, you can't do that. And the idea there is if you put your providers first, if you really take care of them, they'll take care of your patients. So it really is looking at things from an up or downstream perspective. Of course, we're showing up to create a healthcare service as our brand, but you get better results when you can take care of those providers. Their reason for showing up are the patients.